When a patient is scheduled for heart surgery, whether it is coronary artery bypass grafting, valve repair or replacement, or another cardiac procedure, most of the focus naturally falls on the surgery date itself. Yet one of the most powerful factors influencing recovery speed, complication risk, and long-term outcomes lies in what happens before the first incision is ever made, because the concept of prehabilitation, or preparing the body physically before surgery, has proven to be an essential strategy in optimizing surgical resilience, strengthening cardiovascular efficiency, enhancing lung capacity, and reducing post-operative weakness. And essential pre-surgery exercises are not about intense workouts or pushing limits, but about building a stable physiological foundation that allows the heart and body to tolerate surgical stress and recover more efficiently afterward. The cornerstone of pre-surgical conditioning is safe, moderate aerobic activity, typically in the form of structured walking, because walking improves circulation, enhances endothelial function, strengthens heart muscle contraction, and increases oxygen delivery to tissues, all of which are critical during and after surgery, and patients are generally advised to walk at a comfortable but slightly brisk pace for 20 to 30 minutes most days of the week unless otherwise restricted by their physician, ensuring that they remain within safe heart rate limits and can speak comfortably without severe breathlessness, as overexertion is counterproductive. Alongside walking, breathing exercises play a central role in preparation, since anesthesia temporarily suppresses lung expansion and increases the risk of postoperative lung complications such as atelectasis or pneumonia. So practicing diaphragmatic breathing before surgery trains respiratory muscles, improves oxygen exchange efficiency, and prepares patients to perform intensive spirometry and controlled coughing more effectively after surgery, which significantly reduces pulmonary complications. Diaphragmatic breathing involves inhaling deeply through the nose, allowing the abdomen to rise rather than the chest, holding briefly, and exhaling slowly through the mouth, repeated for several minutes multiple times daily to build lung endurance. Gentle strength training is another essential component, as maintaining muscle mass before surgery prevents rapid deconditioning afterward, and light resistance exercises using resistance bands or small weights can improve muscular endurance in the arms and legs, which becomes especially valuable when patients need to sit up, stand, or walk during early recovery, while care must be taken to avoid heavy lifting or straining that could elevate blood pressure excessively. Core stability exercises performed gently help maintain posture and breathing coordination, which becomes important when chest discomfort after surgery temporarily alters movement patterns. Flexibility and mobility exercises also contribute significantly to preparation, as maintaining shoulder, neck, and hip mobility reduces stiffness and supports easier movement during the early recovery phase when certain positions may feel restricted. Balance exercises improve neuromuscular coordination and reduce fall risk after surgery when temporary weakness or medication side effects may impair stability. Beyond physical strengthening, cardiovascular efficiency can be enhanced through interval pacing techniques, where patients alternate between slightly faster and slower walking speeds under supervision, improving heart rate variability and endurance safely. Hydration and electrolyte balance support exercise effectiveness and overall circulatory stability, so adequate fluid intake tailored to medical advice remains important. Patients with diabetes must ensure blood glucose is well controlled during exercise preparation, as stable glucose levels enhance healing capacity and reduce infection risk. Pre-surgery exercise also offers psychological benefits, as physical activity reduces anxiety, improves sleep quality, and boosts confidence, all of which positively influence surgical readiness. It is equally important to understand warning signs during prehabilitation, including chest pain, severe shortness of breath, dizziness, or palpitations, which should prompt immediate medical evaluation rather than being ignored. Coordination with the cardiologist or surgical team ensures Exercise plans align with individual cardiac function and disease severity, especially in patients with reduced ejection fraction or unstable angina. Respiratory muscle training devices may also be recommended in some cases to strengthen inspiratory muscles further. Practicing safe movement transitions such as sitting to standing using proper technique can reduce strain on the sternum postoperatively. Maintaining consistent sleep routines enhances recovery potential, as sleep supports hormonal balance and immune resilience. Nutritional optimization should accompany exercise, with adequate protein intake to preserve muscle mass and antioxidants to reduce inflammation. Smoking cessation is absolutely critical before surgery, as smoking significantly impairs oxygen delivery and wound healing. Weight management through moderate activity reduces strain on the heart and lungs during surgery. Mental rehearsal techniques, where patients visualize successful recovery milestones, can reinforce motivation and reduce fear. Family members can participate in walks or breathing sessions to build supportive accountability. It is crucial to emphasize that pre-surgery exercises are not designed to cure coronary blockages or replace surgery, but to create the strongest possible internal environment for healing. Entering surgery with stronger lungs, better circulation, improved muscle tone, stable blood pressure, and enhanced emotional resilience translates into earlier mobilization, fewer complications, shorter hospital stays, and smoother rehabilitation progression. Patients who prepare physically often report less post-operative fatigue, improved appetite return, and faster confidence restoration. The goal is not perfection but consistency, building manageable habits that continue seamlessly into post-surgical cardiac rehabilitation. Ultimately, essential pre-surgery exercises serve as a bridge between diagnosis and recovery, transforming the waiting period before surgery into an active preparation phase that empowers patients, strengthens physiological reserves, reduces complication risk, and sets the stage for faster, safer, and more successful healing, demonstrating that recovery truly begins long before the operation itself and that every step taken before surgery contributes to a stronger heart afterward.